Good afternoon. I'm joined today by Dr. Vin Duarca, NHS England Regional Medical Director for London, and by Martin Hewitt, Chair of the National Police Chief Council. The rollout of our fantastic vaccination programme continues to make good progress. The brilliant NHS is vaccinating people at the rate of 200 jabs per minute. And as of today, 4,973,248 people have been vaccinated across the United Kingdom. The NHS are working as quickly, efficiently, and as fairly as possible to get the vaccine to priority groups. And I want to take this moment and opportunity to counter some of the disinformation about the vaccine, especially any messages targeted towards those from an ethnic minority background. This vaccine is safe for us all. It will protect you and your family. It is our best chance of beating this virus. So I urge everyone across our wonderfully diverse country to get the vaccine when their turn comes to keep us all safe. But sadly, we are not out of the woods yet. This virus remains severe, and it is a deadly threat. Our NHS is under immense pressure, and large numbers of people are still falling ill and sadly dying. So it is absolutely crucial that you stay at home to protect the NHS and save lives. Since yesterday, 37,892 people have tested positive for coronavirus. As of the 19th of January, 38,676 people were in hospital with coronavirus. That is up 4.8% from the week before. And those who have tested positive for coronavirus across all settings, sadly 94,580 people have died. That is 1,290 fatalities since yesterday. Every death is a tragedy, and these numbers demonstrate that this country remains in the grip of a pandemic. My thoughts go to all of those who have lost loved ones. The sacrifices that millions of you are making day in, day out are starting to make a difference. And by staying at home, you are helping to keep those you care about safe and also contributing to this national effort. But there is still a small minority who refuse to do the right thing. And to them, my message is clear. If you don't follow these rules, then the police will enforce them. Police officers are now moving more quickly to handing out fines when they encounter breaches, and they have my absolute backing in doing so. As we have done throughout this pandemic, we are constantly reviewing our approach to ensure that we can crack down on those most serious cases of rule breaking. And today I can announce that next week we will be introducing a new £800 fine for those attending house parties, which will double for each repeat offence to a maximum level of £6,400. These fines will apply to those who attend illegal gatherings of more than 15 people in homes. The science is clear. Such irresponsible behaviour poses a significant threat to public health, not only to those in attendance, but also to our wonderful police officers who attend these events to shut them down. From the outset, we have given the police the necessary powers to enforce the rules which are in place to stop the spread of this virus. And as these latest measures will demonstrate, we will not stand by while a small number of individuals put others at risk. I want to take this opportunity to pay tribute to our police forces and our fire services for their extraordinary contribution throughout this pandemic. They're out there every single day supporting our communities, risking their own health to keep us safe. And as we have seen in their own commitment during this whole response to the flooding caused by Storm Christoph, during such a difficult time for this country, the commitment and courage shown by our emergency services has been truly inspiring. Everyone has a role to play in our fight against this virus. So please, stay at home so we can protect the NHS and save lives. I'll now hand over to Martin Hewitt, Chair of the National Police Chief Council. Martin.
Thank you, Home Secretary. And I'd like to start by welcoming today's announcement. We have repeatedly made it clear that house parties and other large gatherings shouldn't be happening. They're dangerous, irresponsible and totally unacceptable. And I hope that the likelihood of an increased fine acts as a disincentive for those people who are thinking of attending or organising such events. And we'll work closely with government to implement these new regulations. And as we've done with all other changes to the regulations, we'll be providing guidance to police officers to support them in explaining and applying the rules. When I spoke here 10 days ago, I said that we were at the most dangerous stage of the pandemic and that personal decisions are critical, and that remains the case today. The death figures in recent days are shocking, and I urge everyone to take notice of them. Every person lost is somebody's family member. Gatherings where people are in close contact with each other in confined spaces will allow the virus to spread, and anyone who organises one will be given a fixed penalty notice, and so will those who choose to attend. This is about saving lives. When we see people that are putting others and themselves in danger, we'll not waste time trying to reason with them. They are demonstrating no regard for the safety of others or even themselves. It is important to say that in most of our daily encounters, we only have to engage with people, explain the rules and encourage compliance. And we know that the majority of people are doing their level best to follow the rules in the interest of their fellow citizens and in protecting the NHS. But we must deal with a persistent minority. Official figures will be released next week, which show how many fines have been given since the start of this national lockdown. But forces are telling us that there has been a significant increase, and that's reflecting the fact that we've had more officers out on dedicated patrols, taking targeted action against those small few who are letting everybody down. But what I am able to say is that since regulations were introduced in late August and up to 17th of January this year, 250 fixed penalty notices have been issued in forces in England to people who have organised a large gathering, and those fines carry a £10,000 penalty. And I make no apology for those fines, which are being given in the most serious cases, where those organising those gatherings are selfishly putting lives at risk. And now, anyone who attends one of these big parties can expect to receive an £800 fine. And to illustrate what we're having to deal with across the country, let me give some recent examples. So last week in Brick Lane in London, following reports from neighbours, officers attended a house party where there were more than 40 people cramped indoors. Those people in there were hostile to the police. 3 officers were injured and 1 actually required hospital treatment. And we also found drugs on the premises. And in that case, arrests were made and fines were issued. A house party in Hertfordshire with over 150 people attending was stopped. They had music equipment, mixing decks, amplifiers, all being used by the organisers. Neighbours had contacted us after seeing an unusual number of cars outside. Multiple fines were given in that example, equipment was seized, and sadly, again, an officer was injured in dealing with that issue. In a slightly different sense, an officer who took part in an operation in Bournemouth policing an anti-protest lockdown has since contracted the disease and had to be admitted to hospital. Now, while that infection can't be directly linked to that event, I think what it does do is put into perspective the dangerous nature of policing, even with the adequate PPE that we provide to our staff. This is risky. In Leighton Buzzard, officers were called to the site that had been set up for a large party, where they had a dance floor and speakers. As part of our engage, explain and encourage approach, the organiser was given words of advice and told that that event must not take place. But when officers checked later in the day, 50 people were there. Again, a £10,000 fine was issued. These are just a few examples where our officers are not only exposing themselves to the risks of COVID, but in some cases are also facing abuse and physical assault from those who are willfully breaching the regulations and endangering all of those present. Just today, the Crown Prosecution Service confirmed that in the last 6 months, 1,688 offences were charged relating to assaults on emergency service workers. And from the very beginning, we've been working together with the Director of Public Prosecutions, and we will do everything we can to prosecute those who commit these criminal offences. For every day of this pandemic, officers, staff and volunteers have been out there keeping communities safe and helping to prevent the spread of the virus. And the examples I give demonstrate how dangerous that role can be. The most effective way to reduce that risk is for people to comply with the regulations. And so my message is really clear. Wear a face covering on public transport and in shops unless you are exempt. Self-isolate if you are required to do so. And unless you have a valid reason, or really importantly, unless you need to flee a harm such as domestic abuse, stay at home. Thank you.
Thank you, Martin. Vin.
Thank you, Home Secretary. My name's Vin de Walker and I'm the Medical Director for the NHS in London. Today, dozens of new vaccination centres are opening across the country, including one at a mosque in Birmingham, a cinema in Aylesbury, and an additional 65 pharmacies will start offering vaccinations this week. That's on top of 1,000 GP-led services, more than 200 hospital hubs, and a growing network of large-scale vaccination centres, including Barnet Football Ground in London. Over 4.5 million people have now been vaccinated in England, with more than 500,000 getting the vaccination in London. And we are vaccinating hundreds of thousands of people every day. As a doctor, I would like to encourage anyone offered this vaccination to get it, because it protects you against the seriousness of this awful disease. I applaud the Imam of the Birmingham Mosque who's spoken out about fake vaccine news today, saying it will not win. He is sending a strong message to his community. And together with all my colleagues in the NHS, I stand with him and want to say to everyone, if you're called for the vaccine, come forward. It could save your life. People are being called in priority order so that we can vaccinate those most at risk of serious illness first. And that is why I was horrified to hear reports that some unscrupulous people have used links shared with them to try and falsely book a vaccination appointment. To seek to do this is denying some of the most vulnerable people in our community a life-saving vaccine. Let me be really clear about this. It is morally reprehensible to try and jump the queue, and anyone who books to get the vaccine fraudulently will be turned away. The situation in our hospitals in the NHS remains really precarious. In London, more than half of all patients in hospital are being treated for coronavirus. And sadly, over 1,000 patients died in hospitals in London just last week. Every single one a tragedy. Nationally, there are 34,000 people in hospital and pressure remains intense on our staff. And I'd like to thank all my colleagues in the NHS and our partners in local government, the police, the fire service, the voluntary sector and others who are supporting our enormous efforts in dealing with record numbers of people. We do have hope with an increasing number of people now vaccinated, but we must remain vigilant. Stay home, follow the guidance, and help us to save lives. Thank you.
Thank you, Vin. We'll now move to questions from the public, and the first question is from David. David from Bristol.
Variants will surely be a permanent threat, yet closing borders can only be a temporary measure. Can we not therefore manage the threat on a more sustainable and less harmful basis through the periodic updating of vaccines in a similar way to we currently do for the flu? Thank you.
David, thank you. I think that's a really important point, actually, about updating of vaccines. So, Vin, can I come to you? Because this is obviously something very much from a medical perspective and science perspective that we have to consider.
So, firstly, I'd like to start by saying how fantastic it is that we have developed a vaccine that is effective against this disease. And the research that's been published shows that the vaccine we've got is effective against the strains that we currently have circulating at the moment. So our top priority at the moment has to be delivering the vaccine that we've got and giving it to those who are at the greatest risk of this disease. Obviously, we know that we monitor carefully new variants. This particular virus does mutate. We carefully track those so that we can understand the spread and understand what impact they've had. And that is something that is kept constantly under review by the scientists and by my colleagues in Public Health England.
Thank you, Vim. We go to Robert from Norwich.
As a primary school teacher, I have found it hard to understand why the definitions of key workers and vulnerable children have been broadened, which has led to a frankly massive increase in the amounts of children in schools, increasing the risk of transmission massively. If the virus is more transmissible than 6 months ago and is also more dangerous to children, then shouldn't the protections for our children, their families and school staff be as strong, if not stronger than before?
Robert, thank you for that question, and that was very much about the transmissible nature of the virus. I think it's just worth saying right now, we're speaking about the virus and the variants of the virus that we are now seeing. And it is right to say that within schools and school settings, all the measures that are in place with regards to teachers and pupils being in school are all subject to all the coronavirus restrictions. But Vin, do you want to add something? Because clearly linked to that, we have testing within that particular circumstance and environment to protect teachers, but also to protect pupils. And there's a great deal of work that's taken place across all school settings.
Thank you. So I think that, firstly, I'm really grateful to every single member of frontline staff and key workers for the efforts that they are making, putting themselves on the front line every day. I know that in the NHS, all the nurses, the doctors, the physiotherapists, all of those that we have working, mounting this effort to open hundreds of beds, would not be possible if we didn't have the support of our schools and our teachers in this. So this is an absolutely critical part of it. Clearly, there's a difficult balance to be struck in deciding how to apply how to broaden out the definition of a key worker. But the important bit is that we know that schools have clear guidance on how to make sure that they're safe, that will reduce the spread of this virus. And that is the key bit, I think, that we have to be clear about here.
Thanks, Ben. We'll now move on to Vicky Young from the BBC.
Home Secretary, Northern Ireland has just extended its lockdown until March the 5th, acting on health advice. Could you be straight with people and tell us whether this is also being considered for England? And also on travel, are you pleased that the Prime Minister has finally come round to your way of thinking, which you expressed back in March, that tighter checks and restrictions are needed at the border? And if I could ask the doctor a question as well, please, is the NHS getting all of the vaccine supplies that it needs?
Thank you, Vicky. Well, first of all, with regards to lockdown measures, look, you've heard the numbers today. We are in the midst of a global pandemic, and I'm afraid to say, when you look at the number of people being hospitalised, and also sadly and tragically the number of people who've died because of this dreadful, dreadful disease, you know, we have these lockdown measures. It's right that we, you know, have stringent measures in place, particularly to safeguard, as Dr. Dwaka has said as well, the efficacy of this incredible world-leading vaccine rollout programme that we have. So, you know, it's too early even to speak about other measures, but quite frankly, the advice right now is clearly to stay at home because of the situation that we are in. And then, of course, when it comes to measures, you've mentioned borders and travel, it's right that the government does everything that we can right now, number one, to protect the rollout of this vaccine. But just look at the stringent measures that we have brought in place. You know, we have now, the public need to show proof of a negative test. We have quarantine. We have the passenger locator form. We've taken action at the border when new strains of the virus have appeared, such as the South African virus and also the Denmark virus. All our measures are constantly under review, particularly now. We see mutant strains, and it's right that we take every single precautionary measure so that we can safeguard the delivery of this vaccine. Vin.
Thank you. So I think the first thing I would say is that, that it is very early, but we are seeing some glimmers of the impact of the lockdown in the NHS. So in our general and acute beds, in 999 and in the 111 service, we have seen the number of people with coronavirus falling since last week. But that has not fed through to intensive care, the most seriously ill people. And that is because in this illness, people become more unwell at about 7 to 10 days into the illness. That is where they deteriorate, go into hospital, and may need intensive care. And so actually in London, the numbers of patients in intensive care beds went up yesterday, didn't go down. So it is far too early to be thinking about the lockdown, but there are early signs of hope because the lockdown measures we currently have in place do appear to be having an impact. On the subject of the vaccine, we and our focus in the NHS is on making sure that as the vaccine supplies come in and are delivered to vaccination centres, we get on and administer it as fast as it is delivered. That we're completely focused on the first 4 priority groups. If we get vaccinate those first 4 priority groups, we will have prevented potentially 82% of the deaths that occurred during the first wave of this pandemic, and that would be a fantastic achievement.
Thank you, Vin. We'll move on now to Sam Coates from Sky. Good afternoon.
Good afternoon, Home Secretary. Should people be booking a foreign summer holiday at this time? Or is there a realistic chance Britain could keep its borders closed to people outside the UK until the autumn? Or could it be the case that many other countries and the EU close their borders to us through these summer months? And to Dr. Vindhuacha, is the first wave, in the first wave, the most successful countries were those that shut their borders early? Is the best way to stop new variants coming to the UK to do this and keep them shut?
Sam, thank you. Well, first of all, it is far too early in terms of to speculate around restrictions such as the point you've just made, should people be booking a holiday? You know, we are unquestionably, and I emphasise this, think about the numbers that we have spoken about already. We have thousands of people still in hospital, pressures on the NHS. The advice is very clear. We are in a lockdown. The public should be staying at home. And our focus, of course, with regards to borders and travel, people should not be travelling unless, of course, it is absolutely critical and essential. But we have this incredible world-leading vaccine rollout programme. Our focus is absolutely on delivering that vaccine, getting it to the public, and you know very clearly what the measures are at the borders in terms of quarantine, passenger locator form, the fine just on the PLF has been increased, but also the need for a test. We have stringent measures for a very good reason, because we want to protect the health of members of the public, and also we want to make sure that we can deliver and safeguard this world-leading vaccine rollout programme.
Thank you. So, as the Medical Director for the NHS in London, of course, our focus in the NHS in London is on making sure that we have the beds, the staff, the equipment, the medications that we need in order to treat patients with coronavirus that need to see their GP or access our emergency services or be admitted to hospital. I go back to the answer I gave some moments ago, which is the lockdown that we have in place, there are early glimmers of hope. And I think that's a very positive sign that we welcome in the NHS. I was in a hospital in southwest London, in Carshalton this morning, and in fact, knowing that I was coming here this afternoon, I said to the staff, what message would you like me to give to the British public about what they should do? And they said, tell everybody in the country, follow the rules, stay at home, help us to save lives. If I can give you an example of what's going on currently in hospitals, I visited the intensive care unit this morning, and what I found was normally you have one nurse looking after one patient in an intensive care unit. Because of unprecedented numbers of patients, we now have one nurse looking after 2 or 3 patients, supported by nurses that have come from the surgical wards, from physios that have come in who normally work in the community, supported by dentists, by medical students, and by surgeons, because we've had to bring staff into intensive care to support the care of patients. Now, of course, what that means is that if our beds are occupied, more than half, by patients with coronavirus, and on top of that, we have our staff all focused on looking after coronavirus, that means that they're not doing the things that they want to be doing, like operating on people who need urgent surgery, that needs to be done, not tomorrow because we're still doing emergency surgery, but surgery that might need doing in a month or two because we can't schedule that yet. It means that we can't treat patients as urgently as we want to for some of the things that we think are important, such as cancer surgery and so on. So it's absolutely vital that for the public, the key message is help us to help you, stay at home, follow the guidance, and help the NHS manage this coronavirus pandemic so we can get on with what we're doing best and what we want to do, which is being here for everyone, not just for coronavirus.
Thank you. Liz Bates from Channel 4. Liz, good afternoon.
Good afternoon, Home Secretary. It does seem once again like you're blaming the public for breaking the rules when could it be that the problem is actually the rules themselves? Given the numbers, do you think it's time for measures to be stricter? And on the UK's borders, can you say now that they are secure enough to prevent these dangerous new strains from getting in?
Well, first of all, Liz, in response to restrictions and measures, I've always said, in fact, Martin and across policing and all our operational partners, we are clear that the majority of the British public are following the rules. You've heard today, quite frankly, some pretty shocking examples from Martin. I hear examples like that every single day from policing, and it's really just very disturbing to hear examples of egregious breaches. And the majority of the British public who are complying with the rules will want that assurance. They want to know that when it comes to policing, that those who are breaking the rules are being fined. And these egregious breaches are costing lives. So, we've always said all our measures are completely under review. And when it comes to policing, we continue to work with our operational partners on the type of fines and restrictions and the measures that we put in place. And that has always been the case throughout this pandemic. It is right that we are doing everything at the border, whether it's quarantine, whether it's passenger locator form, whether it's now the testing that we've brought in, and obviously the checks on travellers as well, to do everything that we can possibly do to protect the rollout of the vaccine, and obviously to protect us, to protect the British public and also our vaccine from new strains of the virus. And that is why we've always said all measures are under review. We have this incredible vaccine rollout programme, a great British success story right now. And it's right that we focus on protecting the vaccine, safeguarding, getting the needle into people's arms, the most vulnerable, so that we can save lives. And that is absolutely our focus. Of course, yes, Martin.
Liz, I would be really clear, we are not, and we have never blamed the public. From the very outset of this, we have worked with the public. That's been the stance that we've taken for the last 10 months. And as has already been said, the vast majority of people are trying their level best to follow the guidance, follow the rules. And we all accept the rules have changed over time, the risk has changed, and it is complicated, but we've had police officers out there explaining. But we have to focus on those people who are deliberately breaching those rules and putting people at risk. When you have 150 people coming together for a party, I don't accept that any one of those people didn't understand the risk that they were taking. I don't accept that they didn't understand that that was breaking the law. And we are standing here today with over another 1,200 people died today. And I think people just need to understand that. So it's not about blaming. The majority of the public have worked really hard in difficult circumstances. All of us have, altering our lives. But we really do have to focus on those people who are completely irresponsible, because that is what leads to the situation that we've just heard in the intensive care units.
Thanks, Martin. We'll move now to Jason Groves from the Daily Mail. Jason, good afternoon.
Hi, thanks, Home Secretary. You said it's a bit too early to think about the summer, but this is exactly the time of year when people are thinking about their summer holidays. They want something to look forward to. Can you be clear with people, if they are thinking about booking a holiday now, should they think twice? And Dr. Devaka, you talked about the situation in London right now. You know how many cases are coming through the pipeline. The review of the lockdown is up in 3 weeks' time. Can you see any circumstances in which you will be advising government to lift any element of it, whether it's schools or anything else?
Jason, thank you. You've made a valid point in terms of the public and looking forward, but I do want to absolutely emphasise what I've said earlier on. It is simply far too early to even contemplate where we go with restrictions. And I do just want to bring everyone back to some of the numbers that we've spoken about. Yesterday, 1,290 people have died. The numbers really illustrate, as Dr. Dewaka has said himself in terms of the pressures on the NHS and the hospital, it's right that all our measures are under review. That is inevitable, but right now it's far too early to say or even speculate when we can lift restrictions. And I do want to just come back and emphasise our priority is to make sure that the most vulnerable people are vaccinated. And that is why this vaccine rollout programme is just so critical. It's important, it's crucial to saving lives, which brings us very much back to the fantastic work that our colleagues and all partners are doing on the front line, not just in police and fire, but in the NHS. Vin.
Thank you. So I think the first thing I would say is that I've been the medical director for the NHS in London since the start of this pandemic. And if there's one thing I've learned, it is you can't look more than a few days and potentially a couple of weeks ahead of yourself. And you can only make decisions based on the information that you have in front of you at the time about the trends. So I completely agree with the Home Secretary. It is far too early to be looking forward to the sorts of timescales that you're talking about. The second thing from the public is that, on behalf of the NHS and all NHS staff, I know that this lockdown is really hard. If you're a parent and you're homeschooling, if you're someone who lives on their own and you're lonely, if you're someone that's been furloughed, on behalf of the NHS, thank you, because you are saving lives and you are helping us to save lives. The third thing is, and I said this last week, this is the biggest health emergency to face this country since the Second World War. For me and for my colleagues in the NHS, breaking the rules in the way that's been described today is like switching on a light in the middle of a blackout in the Blitz. It doesn't just put you at risk in your house, it puts your whole street and the whole of your community at risk. And that is why it is absolutely critical that for now, based on the information we've got, please follow the rules, please stay at home, please help to save lives.
Thank you. We'll now go to Steve Swinford from The Times. Steve, good afternoon.
Good afternoon. Home Secretary, the government has confirmed that it's looking at enforced hotel quarantine for travellers coming to the UK. Is that something that you support in principle, and how soon should that come in? Mr Hewitt, Downing Street has rejected a request by Dame Cressida Dick for frontline police officers to be vaccinated ahead of those who are in their 50s and 60s. Do you think number 10 should reconsider, and is that something you think the Home Secretary should look at? And lastly, Dr Dewaka, do we have any figures for what proportion of people are refusing to have coronavirus vaccines and how this differs by group? Is there any group that you have particular concerns about?
Steve, thank you. Well, first of all, you're speaking about speculative measures from what I can tell. And I've already been clear about the very strong and stringent measures that have been brought in place. Testing, passenger locator form, quarantine, and also the fact that carriers themselves are fined for not actually complying with many of these rules, particularly on the passenger locator form. Before I hand over to Martin on vaccination of frontline workers and police officers in particular, I think it's really worth me just emphasising that, of course, vaccine rollout and the prioritisation as to who has access, who will get the vaccine first of all, is down to the Joint Committee for Immunisation and Vaccination, and they're the ones that have decided the categories. That said, we are working, and Matt Hancock and I are working, and the government collectively, to look at the next phase. We've always said that this would be in a phased approach, and it's right that we take that approach, because right now we are focusing on the most vulnerable people that could die from coronavirus if they did not get this vaccine. Martin.
Thank you, Steve. So, of course, I agree with Cress, and I want police officers and police staff to be vaccinated at the earliest opportunity that can happen. We have been talking with government, with the Home Secretary, and I have raised this personally with the Prime Minister from the beginning about making sure that happens as soon as it possibly can. And the reason for that very clearly is I've described some of the situations that our officers are in, and we've been doing this for the last 10 months, and police officers are out there, And of course, they're often going into situations where you have no idea whether somebody may or may not be positive for COVID, but they are getting on and doing their job. So it's really important that we protect our officers in every way we can. And of course, the sooner we get officers vaccinated, then that means that we are absolutely resilient in terms of our numbers to carry on and do all the other policing that we're doing as well. So we have been talking from the outset. I'm confident that our position is really well understood. And as the Home Secretary said, as the body that is deciding on the vaccination works through, we will keep pressing for police officers to be as high up the list as they should be.
Thanks, Martin. Vin.
Thank you. Steve, I wonder if you could just repeat the question that you had directly to me. Thank you.
So, Dr. Dwarka, I was asking, do we have any figures for what proportion of people are refusing to have coronavirus vaccines and how that differs by different groups? And is there any group that you have particular concerns about?
Thank you. So the first thing I'd say, and you can tell this from the pictures that we've seen on our television screens and in our newspapers from vaccine centres today, there is a huge amount of acceptance of the vaccine from people that are being offered it. And of course, our focus at the moment, up until February the 15th, is to make sure that the vaccine is offered to people who are in the most at-risk groups. So there's a real sense of positivity in the vaccine centres and a real sense of excitement. I had somebody that I saw having their vaccine the other day, and they said to me afterwards, they said, "Thank you, doctor, you're going to give me my life back." So there's real sense of hope. Now, of course, we do have communities who do have entirely legitimate and understandable concerns about the vaccine. So we do know, for example, that in some of our Asian communities, in some of our black communities, there are long-standing concerns that actually go back generations because of the history, in the way that people were brought up by their grandparents who were told by their grandparents that experiments were done in the early part of the last century, that unethical experiments were done, way back in the 60s. I am convinced as a doctor, having looked at all of the research, looked at the processes that we have through the Medicines Health Regulatory Authority, this is a safe and effective vaccine. The things that happened historically in the past have not happened now. We have good research evidence, and I would urge people who are offered the vaccine to come together. We are here and we will be absolutely tireless in working with our communities, working with those who've got concerns, working with faith leaders, community leaders, colleagues in local government to make sure that we will answer any question that anybody has and any concern that anybody has to encourage people to come forward and take up their appointment.
Ben, thank you for that. We will go to Rachel Wearmouth from the Huffington Post. Rachel, good afternoon. Hello.
Hello, could I ask these two questions of you, please, Home Secretary? Figures collated by Oxford University covering the last week show that Britain currently has the worst daily coronavirus death rate in the world per capita. Do you think that in hindsight, the easing of rules over Christmas was a mistake? And secondly, Dr. Dwarka said earlier that people jump in the queue to get a vaccine. It's morally wrong. So would the government consider penalties such as fines for this in some cases?
Rachel, thank you. Well, I think first of all, I have frequently said, in fact, all my colleagues across government have always said when you look at the level of transmission, but also the devastation, coronavirus has impacted everyone's lives across the country, but also with the number of people that have died. This is an absolute tragedy. And I think importantly, right now, in terms of our own approach as a government, our approach has always been informed by the professional advice from scientists, from the scientific advisors, from the medics who advise government. And that has always remained the case from day one and continues to remain the case too. With regards to the queue jump in, as you put it, around the vaccine, I completely echo the words of Dr. Dwarka. Quite frankly, it is morally reprehensible because these individuals are putting the lives of vulnerable people at risk, the most vulnerable that have been prioritised by the government to receive the vaccine because they are vulnerable in the sense that they are susceptible to not just contracting the virus, but could die from this deadly, deadly virus. So as I have always said, we say as a government as well, all our measures are under review, but quite frankly right now, our world-class, world-leading vaccine rollout programme is there for the most vulnerable people. We've prioritised our cohorts and our groups, and our focus is getting that vaccine to the most vulnerable to make sure that we can protect them and obviously protect others in the community as well. Thank you. Thanks, everyone.